Can you hear me, Heidi?
Welcome to webinar 5, which is all about looking at the financial data that you can collect in order to really evidence the social impact that you're having as an organisation. So this is also very important in terms of evidencing the potential savings that you make for statutory agencies as well. So it's a very good way for you to be able to show them and demonstrate how effective you are at saving them money in terms of their longer term budgets. And usually we say potential savings, because quite often what happens is that even if you could save money for an agency, the likelihood is that they wouldn't actually save any money, they would just spend it on something else. So that's one of the reasons why it's referred to as potential savings.
Mm-hmm.
So today what I'm going to focus in on is the sources of where you can get the financial data to do this in the first places.
Right.
But really the benefits are that your financial data is easy to understand, and the other thing that it moved forward by accident.
Hi, Heidi.
The other thing that your financial data does is it makes your case studies much more powerful. So if you're able to incorporate this kind of data, then your case studies aren't just based on a few words, you're also including some quite good financial data, as well as the story that you want to tell about what you've done in terms of the difference to the people that you work with. So what I'm going to start with is an example of what this would look like if you were to incorporate some financial data and numbers into your social impact reports. And then once I've done that, I'm going to move on and then show you some sources of different information. Okay, so this example here is an organisation that's worked with an individual who was involved in domestic abuse and also had some issues around caring for their child. So in terms of the different outcomes that were achieved for the various stakeholders, for the individual, they achieved an outcome of having improved parenting skills, and then they were also less socially isolated, which is a big factor in terms of getting support to resolve the domestic abuse that they were suffering from. For the child, the child had improved learning and development because they were no longer witnessing the domestic violence, and the partner of the individual and also this individual went through relationship counselling in order for their relationship to be improved. One of the other consequences of the programme, which was important for the people that were funding the work, was that the individual went into employment, which is quite a common outcome for most statutory agencies now wanting to look at that. And then there was also, because the person had received some support through health services, improving their well-being was another important outcome for them. So in terms of the potential costs avoided, they're all shown there. So by improving the parenting skills, there was potential cost avoided of having social services continue to be involved. You've also got, through the relationship counselling, no costs associated with domestic abuse incidents. employment, obviously no longer claiming benefits and being unemployed, and improved well-being, there's health cost savings through the treatment of the depression. So what this actually then translates to in terms of actual monetary savings is shown on this diagram, and all of these numbers come from various different places. So what you've got is for improved parenting skills, 5,889. Domestic abuse is the biggest potential saving, which is £18,730. Gaining employment, it typically is around about the £8,000 to £9,000 mark, depending on what characteristics the individual has. So in total for this work, for this one individual and their family, their potential savings for statutory agencies are £37,367. So it's showing you how, if you incorporate this kind of financial information into your case studies and your social impact reporting, how powerful you can make your case studies, because the amount of money that you could potentially save is actually huge. Okay, so Pauline, you've just sent through a question, yeah?
Yeah.
How these costs are calculated?
Yeah.
So if I take you to the next page, you'll see all the sources of where this information is.
Okay, great.
So what you've got is all the sources of where this data has originally come from.
Mm.
So, for example, the cost of domestic violence, this has come from a report that was done in 2009. You've got the Department for Work and Pensions, their fiscal benefit from somebody who's currently unemployed and claiming ESA, entering work. Then there's the King's, they do quite a lot of reports around mental health, and one of the benefits of that is that they include a lot of financial figures and data around the costs of particular mental health issues, and they included in that report the average cost of mental health services for anxiety and depression. So all of these figures are primarily calculated by various different organisations. So the benefit of using figures that are already included in other people's reports are that they're verified and they've been proven, and they've done all the hard work in terms of calculating what the costs are.
And how do you become aware? Yeah, go on. Sorry.
A cost that you're looking for, then one of the things that you can do is potentially get your stakeholders to value those costs using the value game. Now, I'll show you in a minute the page for the value game, but it's a great way where you don't have valuations for particular outcomes, and you just typically use where the outcomes are quite soft outcomes. So it might be something where motivation has increased, self-esteem has improved or something. And you need those individuals that have benefited from those outcomes to put a value to that improvement in their soft skills. So one of the ways, as I said, is the value game. But what I want to focus in on is some of these sources of data and where you can potentially go to find them. So if I just do another share and share a different screen for you, what I've got in Excel is a number of different spreadsheets and different things. This one is from Hacked, and it's their value calculator. This one is quite useful if you're working with people that are living in housing associations or within a neighbourhood where you want to look at the impact on that particular neighbourhood, because bearing in mind that they did it from the perspective of their housing association, and they want to look at the added social value and impact that they have as a housing association. So in terms of their spreadsheet, you've got tabs that you can use to put your information in. And then on the social value bank, this is where they've got some financial values that you can use to look and include in your social impact reports. So if someone has gone into full-time employment or self-employment and you don't know their age, then they gave these particular values. Then they did them for people under 25, those 25 to 49 and over 50s. They also did the same for people within London and people outside of London. So there's quite a lot of good data in here. There's also down the bottom things like people having hobbies, doing frequent mild exercise, keep fit, being active in a tenants group or a member of a social group, going to youth clubs, having access to the internet, able to save regularly, being debt free, feeling in control of their life, not having depression, anxiety, and having high confidence. And then there was quite a few that they did around the neighbourhood, so not having vandalism, graffiti, being worried about crime, feeling like they belong to the neighbourhood. So this is more about community cohesion and different things. So in terms of how they got this data, there is a report on their website. So if you follow the link to this, Hacked Social Value Publications, so hack.org.uk/social-value-publications. If you follow that link, then it does give you more information about how they've calculated those values. But it's quite useful. The only caveat is that this can only be used for organisations with small incomes. So they have to have a turnover of less than £350,000 to use the values in here for free. If you want to use them, if your turnover is over that figure, then you need to pay for a license.
That's one of the
spreadsheets. The other ones, if I move to this one, is, oops. I move to this one. This is the NHS National Schedule of Reference Costs, and I've just picked the 2012-13 figures for the benefits of this webinar, but you can get more up-to-date figures. I think the most recent are the 14-15. Now, this spreadsheet is enormous in terms of the amount of data on there, but basically what it does, it gives you a unit cost for every health service that the NHS provides. So you can imagine how big the spreadsheet is really. So if we click on here, let's go on daycare facilities. You can see here what they're giving you is daycare facilities for elderly patients. The national average cost is £155. And they tell you what the lowest figure is and also the highest. Best, in most cases, just to use the average figure. Then let's do A&E. Now, it looks quite horrendous when you see all these things, but where I specifically used it was with a dentist who was looking at what the costs are from them doing work with individuals, as opposed to the individual going for an accident and emergency appointment, and they've got various figures again in there for those types of things. But it is a case of kind of exploring and looking at this. One of the other things that I have used it quite a lot for is the mental health other services, because this is quite frequently around drug and alcohol services. If someone's an admitted patient, mental health services, children with mental health issues, and so there's all kinds of different things within there. Eating disorder service is something that I've done some work on before, so these figures are quite useful in terms of the unit costs for working with people. There's also stuff around autism, and there's also some stuff around mother and baby units and different things on here. So if you want to find the NHS National Schedule of Reference Costs, if you type National Schedule of Reference Costs into Google, it will take you to the link and you'll be able to download this spreadsheet. There's also various other reports and information that link to it, but the best thing to do is obviously just to download and use the spreadsheet, and obviously use the most up-to-date one. Right, so what else have we got? So this one, the personal social services expenditure and unit costs. Again, it's useful in terms of social services. The benefits of this one is it breaks it down by region, so you can get your regional costs as opposed to having them slightly distorted by London. So you've got the total costs for daycare services, and it just goes on for quite a long way, basically, with all different figures that you can incorporate. So slightly different to the NHS one, because this is much more focused around social services, but typically the main ones that people have used are kind of the average weekly expenditure on daycare per older person, and there's also one, I think, for people with mental health issues and lots of other things. So there's all kinds of things that you can include in terms of the financial figures if people are no longer needing to access daycare or such things. The other one to show you, I'm just trying to think which one I haven't shown yet, is this one that was done by the New Economy. So unit cost database, this is version 1.3. I think they have got more recent versions. This is free again to download from their website, and one of the good things about this is that it breaks down into different areas of outcomes, and it's also inflated all the prices. In this case, it was up to 2013-14. So for crime, they've got figures for antisocial behaviour, and the cost per incident is £500, and the updated figure based on 2013-14 is £648, and they also tell you where the original source of that figure was. So if you wanted to look and see if there was any more figures or data that you wanted, you can follow these links to click in and find extra information. But the thing with financial data is that you do have to do a bit of research to find the right kind of data, or alternatively you pay someone like me to find those figures and bits of information for you. So there's all kinds of things in here. Now, one thing just to mention, we've talked about domestic violence when I was going through the example earlier, and there was different figures that were available. So if you find that you're coming up with lots of variations in the figures and the financial savings, the best thing to do is to look and see how they're calculated or where they've come from, and try and find the best source of data. Or alternatively, if there's more than one, then take an average of those two figures if you think they're both kind of valid. But with anything, when you're doing your social impact reporting, it's best not to overestimate your potential financial savings to statutory agencies. So generally speaking, it's better to err on the side of caution and take the lower value if it's appropriate. So there's all kinds of things in here for crime. Education and skills, there's a lot around exclusions, truancy, people gaining qualifications. Then you've got your employment ones, which are around people coming off benefits and getting into work. There's some around fires, which would be relevant obviously primarily for fire services or people that are working to prevent arson and different things. Then you've got health ones around drugs, alcohol, people attending hospital. You've got ones around housing. These figures are really useful if you're working with organisations that work with people that are homeless, because this tells you what the costs are for evicting somebody, for somebody being homeless, somebody being put in temporary housing, and you can see that actually the costs would soon stack up if you were to be able to prevent someone becoming homeless in the first place. And then you've got your social services. If a child is taken into care, this is now updated. The cost is £64,819. So imagine the enormous impact an organisation could have if they stop just one child going into care. And most organisations, if they're doing this kind of work, they're perhaps stopping several hundred children going into care. So other things that we've got on there around child protection, children in need, doing an assessment via social services, what the cost of that is. So there's all kinds of data in here, and all the links to where it came from. So this personal social services expenditure and unit costs, which is similar to the one that I've previously showed you, but they're all free to download. The other thing that I want to show you as well is the, let's just find, where are we? This globalvalueexchange.org. Now, the Global Value Exchange has got some financial proxies on it. There's not always masses of values on here, but there is a lot around outcomes. So if we were to search for self-confidence and see what comes up. So if with that search, what you've got is there are 11 outcomes that's telling you there's 33 indicators. And so what we talked about in last week's session, where we said how the ways of knowing that an outcome has been achieved, they're potentially saying there's 33 different indicators that people have used that you might want to use if that's something you were going to measure. And then there's 5 valuations. So let's have a look at the 5 valuations and see what they've got in here. So for improved self-confidence, what they've used as their financial value is someone having assertiveness and self-confidence training, and that looks like they've used, that's the figure that's been used on all of the different valuations. So they're looking to value this confidence for NEETs, children that are 11 to 16, self-employed people, and people with learning disabilities, and they've used this financial value of the cost of a self-confidence training course. So that's potentially something you could use, but obviously you can search in here and see what values come up for whatever it is that you've got as a particular outcome, and see if there's anything that seems relevant. But what I've found is that often the outcomes are quite unique, and there isn't always the data and figures there. So what you quite often end up having to do is do a lot of research into reports and different data that's out there to find the most appropriate financial value. The other way to do it, as I mentioned earlier, is with this value game. So I'm going to just search for the value game. And here it is. So the valuegame-online.org, and basically the value game is a survey that gets you to ask your stakeholders particular questions to get a value for a particular outcome. Now, I've done this before, and the best, or I suppose the easiest way to explain it, is that you have to get items that have monetary values that are relevant and important to that particular stakeholder group. So you could ask them all to bring in 2 pictures or 2 cutouts from magazines or something of items that they consider important and of value. So if you were working with young people, then it might be the latest phone, or the coolest pair of trainers, or something that they bring in pictures of. And then you ask them to assign or put these items, or as a group they have to kind of select some that are meaningful to all of them. So if there was perhaps a group of 6 young people, you might end up with 6 images that they all agree have some meaning and value to them as a stakeholder group. And then you get them to rank them in order of what they perceive their monetary value to be from the lowest to the highest. And then once they've done that bit, you ask them where they would place improved, let's say we're doing self-confidence, where they would place that between these different items. So if they've got a phone that costs £1,000 and the latest pair of designer trousers that were £800, they might place self-confidence, having improved self-confidence, between the phone, which is valued at £1,000, and the trousers at £800, and therefore you'd then take the average of those 2 values and come up with £900 as your value for self-confidence. So it is a way to do it. What they've found when people use this value game is that the values tend to be higher than those what you'd get where you've actually collected the figures and data on what the financial savings are. But you can use this website to actually do the value game online, so people can actually do it and click the buttons and do this valuation on here rather than having to do it within a group of individuals. So it's another great way to get a valuation where it seems that there isn't actually a value for a particular item and outcome that you're achieving. Okay, so let's just skip back into the presentation. So that's it for today's session. Obviously, you've got my contact details if you do have any questions. Is there any questions that anyone's got that they want to ask now?
Yeah, Heidi, my question about the UK data, whether it was open data, you know, the tables that you've shared so far.
Okay, so there's one question about the data being open data. So as I said, all of the data that I've shown you and shared with you is free to use. It's all publicly available and accessible, and so things on the Global Value Exchange database, they can be used. All of the spreadsheets, the only one that's got any restrictions is the one from HACT, where you have to get a license if your turnover is more than 350,000. But other than that, all of the data can just be freely used and incorporated in your reports. So obviously, if you're doing a social impact report and using these values to show and demonstrate the potential savings you make for statutory agencies or the value of your work, then it's beneficial to include the sources of the information, because then it makes it verifiable, and you also don't risk the potential issue of a commissioner coming back to you and saying, well, where did you get this figure from, and you not remembering where you actually got that particular figure from. Increasingly nowadays, there are more and more commissioners and statutory agencies that are asking for this type of analysis, so more of a social return on investment style analysis that they expect people to include when they're tendering for work, and also when they're doing evaluations and reporting back on what they've achieved as an organisation. So, okay. Are there any other questions?
I've got one more. Can you hear me? Can you hear me, Heidi?
Okay. Well, in that case, what we'll do is we'll stop there for today. So, thank you very much for joining, and have a pleasant rest of the day. Thank you.